Pope Francis' health crisis worsens. Pope suffers 2 episodes of acute respiratory failure. Amid deteriorating health, Pope Francis back on ventilator. Experts say coming days crucial for the Pope. The Vatican on March 3 has said that Pope Francis experienced 2 episodes of acute respiratory failure, marking the latest in a series of medical crises the 88-year-old pontiff has endured since he was first hospitalized in February 2025. According to reports, the March 3 episodes were caused by a significant accumulation of endobronchial mucus and a consequent narrowing of the airways. According to the Vatican, the Pope underwent 2 bronchoscopies and doctors removed a buildup of secretions on March 3. In the afternoon of the same day, Francis was given oxygen through a mask to help his breathing. The Vatican added that throughout, the pontiff remained alert and cooperative. Pope Francis also suffered a bronchospasm, similar to an asthma attack, which required doctors to perform 2 bronchoscopies or procedures to inspect his air passages. The Vatican said that the pontiff's prognosis remained guarded, which means that he is not out of danger. However, according to a Vatican official, Pope Francis's blood tests on March 3 remained stable. The official reportedly spoke on the condition of anonymity since he was not authorized to discuss the pontiff's health. The official added that the Pope's doctors believed the respiratory episode was part of his body's normal response in fighting infection. There had been relatively upbeat statements about Pope Francis's condition over the weekend after a previous bronchospasm on February 28. Meanwhile, a Vatican source talking about the health of Pope Francis reportedly said the picture is still complex, and that the risk of crisis remains. Dr. Panagis Galiatsatos, pulmonary and critical care medicine physician at Johns Hopkins, told a media network the coming 10 to 11 days will be crucial in determining whether Francis can recover. He said patients of the pontiff's age and condition would normally need a month in hospital, and should the Pope recover, he would need a month of convalescence for every week spent in hospital. Pope Francis has been hospitalized at Rome's Gemelli Hospital since mid-February, where he has been battling double pneumonia. On February 28, he had a sudden respiratory episode, which required him to receive an oxygen mask. His current hospitalization is his 4th, and now longest stay since he became Pope in 2013. The pontiff has suffered from lung-related issues for much of his life. Remember, as a young man he suffered from severe pneumonia and had part of one lung removed.